As of right now, the novel coronavirus is in its early stages around the globe. The World Health Organization is currently not classing this as a pandemic yet, but has set a very high-level threat on this virus. Today we're going to take a look at WHO's own phases for a pandemic that they released during the 2009 H1N1 outbreak, also known as the swine flu. The phases has 6 stages. They follow as: Phase 1. No viruses circulating among animals have been reported to cause infection in humans. Phase 2. An animal influenza virus circulating among domesticated or wild animals is known to have caused infection in humans and is therefore considered a potential pandemic threat. Phase 3. An animal or human-animal influenza virus has caused sporadic cases or small clusters of disease in people, but has not resulted in human-to-human transmission sufficient enough to sustain community-level outbreaks. Limited human-to-human transmission may occur. Phase 4. Characterized by verified human-to-human transmission of an animal or human-animal influenza reassortment virus able to cause community-level outbreaks. The ability to cause sustained disease outbreaks in a community marks a significant upward shift in the risk for a pandemic. Phase 5. Characterized by human-to-human spread of the virus into at least 2 countries in one WHO region. While most countries will not be affected at this stage, the declaration of Phase 5 is a strong signal that a pandemic is imminent and that the time to finalize the organization, communication, and implementation of the planned mitigation measure is short. Phase 6 is characterized by community-level outbreaks in one other country in a different WHO region, in addition to the criteria defined in Phase 5. Designation of this phase will indicate that a global pandemic is underway. Now the question is, where are we in the phases that WHO declares a pandemic? We're beyond Phase 1, where no viruses have caused an infection in humans. Phase 2 is where an influenza virus has caused an infection in a human. This is reported happened as of the 31st of December 2019, when China first alerted the World Health Organization about an unusual pneumonia. Phase 3 is when the virus is causing sporadic cases or small clusters of disease in people, but has not resulted in human-to-human transmission sufficient to sustain a community-level outbreak. This phase was succeeded on the 22nd of January, when China had more than 550 new cases, and on the 23rd of January, air and rail departures were suspended. As of the 22nd of January, when 550 new cases were confirmed, Phase 4 criteria described as verified human-to-human transmission of a virus that caused sustained disease outbreaks in a community was succeeded. Phase 5 described as human-to-human spread into at least 2 countries in one WHO region. This was succeeded on the 26th of January, when a South Korean man was admitted to the hospital, which makes China and South Korea 2 countries in one WHO region. Phase 6 described as community-level outbreak in at least 1 other country in a different WHO region. This phase was succeeded on the 21st of February, when 16 new confirmed cases in Lombardy, Italy was detected. According to WHO's phases of a pandemic, we reached a pandemic level threat on the 21st of February, but the WHO still classifies this outbreak as non-pandemic.